We hear the phrase social distancing a lot these days with the spread of the new coronavirus. But what does that mean in your day-to-day life? First, let's look at why social distancing is important. The coronavirus is spread through droplets from your nose and mouth that land on surfaces or people when you cough or sneeze. If you stay away from surfaces that are used by a lot of people, or if you stay away from people outside your family, then you're not spreading those droplets and infecting others. It's important to remember to keep your distance from others, healthy or not. A 6-foot distance is recommended. It can take 2 days to 2 weeks for symptoms to show. Even if you show no symptoms, you can still have the coronavirus and spread it to others. Our healthcare system can only handle a certain number of sick patients at one time. That's this flat line, the capacity of the U.S. health system. The red curve shows what will happen if we don't do anything. This infection will spread quickly and to a lot of people. Our hospitals won't be able to care for so many sick patients all at once. They just won't be able to keep up. Patients that are in the red part of the curve are above the line. They are not going to get all the care they need because hospitals will be overwhelmed. They might not have enough beds. Doctors might be spread too thin. Breathing machines might not be available to all those who need them, and some people will likely die. By practicing social distancing and good hygiene, we can help slow down the spread of the disease, reduce the number of people who get sick and need hospital care. This gives our hospitals a better chance of taking care of everyone who needs it. That's the blue curve. This is what we mean by flattening the curve. By slowing down the spread of the disease, we can space out the number of people who need serious medical attention. This means that those who need care can likely get it, and we save lives. To flatten this curve, one of the most effective ways is for all of us to practice social distancing. It's preventative and it works. So what does social distancing mean for your everyday life? No play dates, no parties, no sleepovers, no visiting friends in their home, no meeting in restaurants or coffee shops, no playing basketball in the park, and no playground equipment, no going on casual dates, no going to the gym. Limit time spent in the grocery store. Keep 6 feet of distance between you and non-family members. If family members are sick, keep them separate and use precautions with interactions. No hugging, kissing, or shaking hands with those outside your household. It's tempting to think it's okay to connect with just that one friend. Just that one connection can spike the spread of coronavirus and make the need for social distancing last even longer. Kids who are used to being around school friends all day, parents who want to connect with other adults, and people in general want to be together. But people who come over looking well can transmit the coronavirus. What can you do? Go for walks or runs. Spend time in nature. Embrace technology by connecting online with friends and family through video calls, texting, and social media. Work in your garden, workshop, or kitchen. Try to knock out things on your to-do list. Indulge in podcasts, books, hobbies, music, movies, and family time. Humans are naturally social. Social distancing may seem unnatural at first, but it's important. Finding new ways to live fully and connect from a distance will give us all a chance to help stop the spread of this new coronavirus.